Good morning. My name is Cesar Pellerano. Welcome to the AMMG. I have the pleasure to be here with Dr. Joseph Bosilijevac, who's been a personal friend, and he's been a friend of the AMMG for many, many years. Dr. Bosilijevac has had a background in surgery for many years, but now he's doing some exciting work with stem cells and see how the stem cells are going to help us in wound healing, helping our immune system, and other things. Dr. Bosilijevac, welcome to AMMG.
Nice to see you again.
Tell us, what kind of work are you doing now with the stem cells?
Well, my conventional medical training was as a cardiovascular surgeon, okay? And I did that for 29 years near Kansas City. About halfway through my surgical career, I'm scratching my head because patients are sent to me for surgery and they're on 20 different meds, or they mention some alternative treatment they may have had that seemed to help. And I thought, we're missing some stuff here in conventional medicine. So I went ahead and got another doctorate in natural medicine. Okay. So I was doing both of them together for a while, and had a chance to come up here to New York City and open up the Centogenics office on Wall Street. And I quit doing surgery. And I've been up in New York doing this for 13 years. So I got involved with stem cells because some of my first patients were retired NFL and NBA players. Okay, so I'm doing joint injection, soft tissue injection, stem cells, pretty straightforward. Later, I got involved with military special forces. So soft tissue and injuries and things. But these guys are approaching me, Doc, I've got traumatic brain injury, I can't breathe, I've been exposed to a bunch of stuff, things like that. So I started looking at doing treatments for these patients in a systemic fashion, okay? And you think in terms of, okay, you give the stem cells intravenously, where do they go and what do they do? And this is kind of what I worked my way through. And part of it is, as an old surgeon, this is wound healing. It's not giving stem cells. It's preparing the body to heal and then supporting the wound healing principles. So, for instance, on the military guys, when I started doing the systemic treatments, intravenous, lung is a perfect target organ for the stem cells. So when they have lung issues, boy, all that clears up.
So how do we know when you inject a stem cell that it's going to go to the right place?
Well,
you want it to go to the lung, but why doesn't it go to the heart?
Well, except I think that I have seen improvement in heart status, so somehow there's some cross circulation there, but the stem cells get trapped in the capillaries in the lung. Okay. Now, if I was going to do something else, I want the stem cells to be focused in the head for an injury here. Okay, I can use a red light and certain frequencies that will stimulate, and what it does is part of wound healing. The first thing that happens, the body increases the circulation. That says, you need to do something, the body goes in there. So this red light can light things up. The other thing I do, and I'll show a video of this in the lecture, I do a sphenopalatine ganglion block, okay? That's sticking a needle here, about this deep, okay? The skull, it's got a kind of a funnel. This is all jaw muscle, but at the very bottom is the sphenopalatine ganglion, where a lot of cranial nerves cross, especially the vagus nerve. And using that with MS patients or traumatic brain injury, I've done the injection there, hoping I get them centrally, and I see lesions clear up. So I know it's working. So that again is another trick that I found along the way to help encourage where the stem cells are going to go.
Right. So there are ways for you to steer the stem cells into going where you want them to go.
Yes.
Correct. So what else are you doing as far as wound healing? And because I know you're doing a lot of exciting work with stem cells. So what else are you doing right now?
Rather than saying I do stem cell treatment, I do rejuvenation treatments.
There you go.
Stem cells may be part of that, okay?
Right.
Now, for instance, somebody with a traumatic brain injury or MS, pathologically what happens is those nerve cells dump out all their NAD. Then you get a neuropathy, okay? So part of a treatment will be giving the patient some intravenous NAD 3 days in a row to build up their stores. And what I've seen with this is these patients will improve with their neuropathy temporarily. You're just filling up the gas tank. But it makes me optimistic that doing something more solid with the stem cells may make that more permanent for them. I've been using peptides also to help regeneration and that sort of a thing. And then you add the stem cells or the exosomes on top of that, and basically what you're looking at is you're rejuvenating the system. And I can tell you this, when I was 62, I had a terrible adult life. My kids, I'm eating fast food, eating candy all the time. 55, I went into a health program, okay? And at age 62, well, okay, let's see what I'm doing. I had a telomere measurement, and my biologic age was 56. So I pat myself on the back, oh, you're doing fine, everything, okay? I went ahead, and some of the things I do with stem cells, I do to myself before I do to the patient, okay? I went through 2 sets of treatment myself, including a certain peptide that increases telomere length. So at age 70, I had another telomere measurement. My biologic age was 54. I'm at least holding my own. And so that's part of what I look at with overall health, is you're keeping your metabolism at a more healthy state.
So really the stem cells are just part of the system.
They're just part of it,
They're just
yes.
part of the treatment. It's not a stem cell treatment. It's rather a whole body rejuvenation.
Exactly.
Keeping the patient healthy, making the patient's health optimized, their biochemical condition, their hormones, all of those things.
Yes.
And when the patient is in a good state, then the stem cells are going to be able to help the patient even more.
Exactly.
Excellent. Well, thank you very much for joining us. This is extremely interesting, and I hope to see more of your work in the future.
Okay.
Okay, take care.